Good morning. I'm leading off this morning, and I'm going to be talking to you about some of the outputs that the Centre's produced which try and describe health in Glasgow. And this is a range of outputs we've produced over the last 9 years, and following me, David will be talking about the excess ill health in Glasgow and the west of Scotland, and what might lie behind that. But this was the headline in The Guardian from 2006 that inspired the title, this comparison of life expectancy in Iraq, comparing that with Calton in the east of the city. So I guess one of the things this shows is the media like a good headline. They also like to talk in stereotypes. So this is the first paragraph from their piece. I won't read it all out, but they say the ghosts are sitting in the cottage bar, the men who died before their time, etc., etc. They also seem to quite like to have a bizarre comparison. In this case, Calton, a small population of 5,000 compared to not only Iraq, but North Korea and the Gaza Strip. Buried within this piece, there was actually some of the information from the health profiles from where the statistic originally came, which might start to tell you why health was so poor in this particular area. And there was also a political reaction to the report. And I think this just makes the point that this kind of information is not neutral, it is political, and it will be seized on by all sides of political divide. And I think we just need to be aware of that. So I'm going to take you through a number of these resources, like Glasgow Flourish, health profiles we produced in 2008, the miniature Glasgow film, and more recently the Understanding Glasgow web resource. And in so doing, I'm going to try and, I'm going to pose a set of questions and maybe answer some of them. How have people used these resources? How could they be used? What's been learnt? And through all of this, the theme of inequalities, I think, will come through quite strongly. And before I go into the resources, I'd just like to make the point that underpinning all of this work is these types of socio-ecological models of health, models that recognise the range of factors that interact to affect health through the life course. And these models describe a system, you could call it everyday life, that can both create and destroy health. And in thinking about these models, we also have to populate them, and to do so we've accessed a huge range of information from survey and from administrative sources. So, turning to Let Glasgow Flourish, which was described as a comprehensive report, also a coffee table book, a thick tome in 13 chapters and 300 odd graphs describing health in Glasgow and the west of Scotland. You won't be surprised that I want to show you a few graphs now. This particular graph showing infant deaths over a 150-year period in Glasgow demonstrates quite a success story. So in 1850, a child born in 1850, only 1 in 5 was likely to survive to their first birthday. And clearly there's been a big improvement in infant mortality survival, down to improvements in healthcare, improvements in hygiene and housing and overcrowding, etc. It's also interesting to reflect that in 1901, when we compare Glasgow on this particular indicator with other cities, it didn't compare so badly. The level of infant mortality was similar to that in London, was actually much lower than in Birmingham, Liverpool and Manchester. So Glasgow's position is not necessarily unchangeable. And this next graph illustrates another point that came out of the report very strongly of inequalities. This is a graph of male life expectancy in the Greater Glasgow area, and you can see an increase in life expectancy of about 4 years over a 20-year period. And you can also see that for men living in the least deprived 20% of the population, life expectancy was also increasing. And there's a gap of about 3 years of extra life in these more affluent areas. But it's when we look at the most deprived 20% of areas, we see really no improvement in life expectancy. And in fact, it may well be that life expectancy in these communities for men actually went down. When the report came out, this was, despite the range of information that we produced, the headline focused on one particular area, an epidemic of drink abuse. But what did we say when we produced the report? Well, in conclusion, we said that past and current strategies have not worked, that Glasgow needs a new approach, and in our report we called for a so-called civic conversation. And this idea of a conversation and discussion about how Glasgow could be different is a thread that I think runs through the work of the Centre since its inception in 2004. Turning now to the community health profiles. These were started within the Public Health Institute of Scotland and were taken up by Health Scotland. They have fed into Let Glasgow Flourish, and the Centre itself produced a set of profiles for the Greater Glasgow and Clyde region in 2008, and indeed there's a further set of health profiles produced as part of Mental Health in Focus last year. When we produced the 2008 profiles, we had a number of aims for them. So what we're aiming to do was to highlight health and social inequalities, to try and provide communities with up-to-date and relevant health intelligence, to illustrate trends, what's getting better, what's getting worse, to provide a resource for priority setting and targeting, and to develop this slightly better understanding of the complexities around health and health inequalities. And this type of graph, we've called them spine charts, have become synonymous with the profiles and synonymous with describing inequality. In this spine chart we see Bishop Briggs, which is part of East Dunbartonshire, a relatively affluent part of the Greater Glasgow and Clyde region, and what we see here is most of the indicators in this area pointing to the left, better than the Scottish average, reflecting better health. And then if we look along the road to in Kirkintilloch and Hillhead area, we see the polar opposite pattern, an area with much, much worse health. And if you look across the Glasgow region, there are many neighbouring areas, Chute by Jowl, which show these contrasts across the city. So rather than talking about a tale of two cities, I think we could be talking about a tale of many cities. Now, this is a graph illustrating drug-related deaths across CHPs in Glasgow, taken from the same profiles. These CHPs at the time had populations from 80 to 200,000 people. And I put this up to bring this discussion back to Calton. Calton, a small population of 5,000, and you can see the level of drug-related deaths in this area. So an indicator from another part of the profile start to illustrate why male life expectancy was so low. So drug-related deaths and indeed alcohol-related deaths are a big part of the story of Calton. But we've used other information, not just about health outcomes, but also wider determinants of health. This map of green space in East Glasgow is a good example of that. And this is the kind of resource that we're trying to integrate within the Understanding Glasgow resource, which I'll be talking about in a few minutes. These profiles were evaluated and they were confirmed that they were a good source of health intelligence for local areas and were being used to identify priorities, were used as evidence in planning reports, and were used for targeting resources. And the format of the profiles is seen as accessible and easily understood. So I think it's not unfair to say that health profiling has become well established now as a way of providing health intelligence for communities across Scotland. However, in more recent evaluation work that has been undertaken around the Mental Health in Focus report, which was produced by Deborah Shipton at the Centre, we have found some limitations in the use of these types of resources. We sometimes struggle to get them to the right people, so there's a dissemination issue. We also have to be aware of the danger of information overload within organisations and for individuals. The currency of health intelligence is interesting. Health intelligence is just one of the competing agendas that community planning has to deal with. So we need to make this health intelligence summarised and relevant. And there's another issue, I think, in terms of capacities and skills of the wider public health workforce to make sense of this type of information and be able to synthesise it. Maybe some of the ways of dealing with this are to work more closely, and by this I mean between those who produce these types of resources and those that use them, and also in a collaborative way supporting use and dissemination. Turn now to Miniature Glasgow, which in many ways may seem like a very different resource, but is actually underpinned by the same sort of information that you saw in the health profiles and Let Glasgow Flourish. But this concept of a neighbourhood of 100 people seems to be a concept that people can grasp. And we managed to provide a wide range of information about Glasgow in a very short 8-minute film about diversity across Glasgow, something about the educational differences across Glasgow. This slide illustrates the high level of smoking still in the city. And also this slide illustrates the fact that Glasgow has moved from being a city built in industry and manufacturing to one where we actually manufacture and create very little. And most people, about 80% of the population in employment is now in service industry employment. This final slide from the film illustrates an income inequality, and it has been commented that this is probably quite an underestimate of the real gap in income across the city. The feedback I'm going to show you here is all very positive because I've selected it, but generally there has been very good response to this film, and it's interesting that it's been well used within both higher education and secondary education. And we've developed this concept into a second film where we've compared Glasgow to Gothenburg using the same concept, and we're now embarking on a project with other European cities to develop a European project comparing cities. So I'll turn now to Understanding Glasgow, our web resource. Now, Understanding Glasgow was set up for a number of reasons. One of the impetuses was an economic report in 2007, which described progress in Glasgow purely in economic terms. And we and other partners reacted to this and suggested that there needed to be a much broader set of indicators to measure progress in health and well-being and quality of life in the city. The Understanding Glasgow resource is also set up as a way of monitoring the recommendations of the 2009 Health Commission, and there was 20 recommendations for how Glasgow could become a healthier city. And this type of resource is a way of being able to look and see what's happening in Glasgow. As we developed the resource, and I'll describe that shortly, a set of key features or principles developed. We were interested in a basket of indicators rather than one index, and this was because we wanted to represent a dynamic and interlinked view of the city. We've focused on themes that we think are clear priorities for the city, so they might not be the same themes that you would identify in another city. We're trying to provide a strategic overview, so we've tried to balance not having too many graphs and too many indicators, but that's clearly is a balance, and we may not have got it right. We're trying to show trends over time. We're showing inequalities across the city, and we're also trying to make comparisons where we can with other cities, both in Scotland and the UK, and again where data allows to European cities. We've been informed in this work by the IFF's World Model and by work in other cities, for instance the Boston Indicators Project, which has been going for about 15 years. This rather busy slide, I put it up to illustrate the process that we went through in creating Understanding Glasgow, and this was very much a collaborative, iterative, organic process where we asked people about the concept of creating a set of health and wellbeing indicators for the city. And I think taking this collaborative, organic process approach forward worked. It got support and commitment from a range of partners across the city, and I would describe this as a really effective example of joint working. Here's some screen grabs from the site just to illustrate what you would get on the site. So this is an overview from one of the sections on transport, which gives you a quick overview of that particular theme for Glasgow. And in other parts of the site, you will just see a particular statistic. In this case, the uptake of the 5 a day fruit or vegetables across the city and how this compares across different population groups. Here we have community safety priority areas on a map, and this is a section that's actually authored by somebody in the Community Safety Partnership. And we've also made a link between the indicators and some of the targets and strategies at a national level, but also at a local level. We make links directly to some of the single outcome agreements. So out of all this, these different resources, what have we learned? Well, I think we've learned that local health intelligence, which is well presented, relevant and from credible sources, will be used. In an increasing diverse digital age, the way we present information is important, And we need to evolve the way we do that, and one format is not the solution, it's probably many. But we need to be aware of the potential for information overload. We need to be thinking about capacity issues within organisations, and we certainly need to be tailoring and summarising our findings for others, for users, by working with those users. Specifically thinking about understanding Glasgow, positively it's been described as an initiative for democratising information, a one-stop shop for information. And as I've said, the collaborative process in creating the indicators, I think, has facilitated their adoption and use. But it's early days, and the challenge now for us is to develop the resource and also embed its use within Glasgow. And on those last 2 points, I'd just like to illustrate 2 ways we're trying to do this. We already have a set of films on understanding Glasgow, but they're very much based on the statistics that we provide elsewhere in the site. And one of the things we're trying to do, we've commissioned Simon Parsons to create a set of films that reflect more of the stories of Glaswegians, their lived experience of the city. And these films are coming soon. In fact, they're available at lunchtime today. And I hope some of you will come down and view them. Finally, this is a set of images just illustrating how we've used the indicators with, in this case, a group of mainly school children to discuss the strategic issues around the city, how the city is just now and how it could be in the future. And we see this very much as a continuing conversation and a particularly positive use of this type of resource, and something that we're encouraging and trying to stimulate in the years to come. Thank you.